A few moments to join, but so excited to have you. We're just going to wait a little bit because we have people trickling in. But thank you so much for joining this really critical event. We're covering the new advancement at CMS and how we can be better advocates for expanding protections for our brain injury survivors and their care system. Oh yeah, we have a bunch of people trickling in. Great to see you. Thank you so much. And those who are joining on any streaming service, great to see you. Sorry we can't see your name. But very excited to have such a great turnout. All right, I think we've hit a, oh, no, we still have people streaming in. We'll give it another 30 seconds. Great to see some familiar names as well. Thank you so much. But we love new names. We love to see new advocates and champions in the space, learning and evolving with us. All right, we've been at steady at 75 for about a minute. We're just gonna go ahead and start with introductions. So if anyone else trickles in, they can still get some really great substance. But good afternoon or morning, depending on where you are in this nation. I'm so excited to have you today. My name is Denver Stupinger. I'm the Director of Advocacy and Government Relations for the Brain Injury Association of America. Today, we're joined by some really great superstars. Karen Kibsney, the former director of Department of Medical Assistant Services in Virginia. Paul Bosworth, one of our wonderful Survivor Speaker Series individuals and a great advocate. And then also Darcy Keith, another brain injury survivor who'll be speaking about her journey. Very excited to have you. I just want to say, those who are joining on the webinar, just for some tech background, if you have questions, please put them in the chat. We do have a staffer monitoring the chat, so please feel free to ask questions and we will address them at the end of the presentation. And we're hoping for a really lovely event. So thank you so much for being here. All right. Oops. There we go. We're just going to change the speaker view real quick. All right. So you all are here to learn about the update by CMS. What exactly happened? How did this happen? How is that going to impact you, your clients, your loved ones, your community? And we're excited to break that down for you. So earlier this year, CMS updated its chronic special needs plans, or CSNPs, to include traumatic brain injury. This is something that has not been included for quite some time and is a huge progression for us, for it ensures that those with traumatic brain injuries and ailments associated with brain injuries will be protected. This plan will not take effect until January of 2025. So just want to flag that for you all, and we'll go over the process of how to access the plans for folks. But it's a really great step step forward. You might be wondering what a special needs plan is, and essentially it is a plan that's approved by Medicaid and managed by private companies. When you enroll in a Medicaid SNP plan, SNMP plan, the plan covers all your Medicare hospital, medical care, and prescription drug services. It also helps with coordination of care, which we know is very huge for the brain injury community, ensuring that our neurologist is talking with our PCP and other providers that we interact with. So it helps with the flow of communication and flow of services. Like other Medicare health plans, when you join a SNESIP plan, you'll need your providers, you need to see providers within the plan network that you have. So under this specific CSNP plan, which is once again the chronic special needs plan, it's for Medicare only, and it's Medicare Advantage Part D. And I'm hoping that's a little bit of clarity for folks. If you are interested or eligible, which we'll go into a little bit more, the plans once again start January 25th, and the enrollment process for these plans is your normal enrollment time, which is October to December of this year. You will need to contact Medicare directly to see if a plan covers you and if you are eligible. And if you are, you will most likely need a letter from your primary care physician or a doctor that you see to say that you do have a traumatic brain injury, there are chronic conditions associated with it, and that you are eligible for this plan. Oh, before I go forward, there are some questions about does this include acquired brain injuries? So I want to put that in the parking lot, but as we're noting, this is only for traumatic brain injuries. If you're not aware of how to enroll, please see your Medicare and You Health Handbook. Visit medicare.gov/find-a-plan, find-a-plan, or call Medicare at 1-800-MEDICARE to learn about these plans. A limitation, as we've heard from Bertha in the chats, is does this include acquired brain injury? There are some acquired brain injuries that are already included in chronic special needs plans, but it is not holistic. So once again, you'll have to consult with your Medicare plan. But we are advocating within BIAA and with our connections at CMS to ensure that this expands beyond just traumatic brain injury and that acquired brain injury. Okay, what other questions do we have? And I'm happy to address more questions in the end. We do want to put the caveat that this is a very specific that this is for folks who qualify for Medicare and Medicaid. You have to be with Medicare Part A and B, so those are income and age restrictions, unfortunately, and that you have to be within an area in which the payer provides the services. So at this time, Medicare has advertised the CSNP as an option for payers to adopt, but there is no mandate that payers adopt this chronic special needs plan, nor is there a mandate of what areas are or are not covered if they do adopt a CSNP plan. So that's where our advocacy comes in, and that's something we will hit on later on. But to kind of put this in perspective of one, how this is a great improvement, and two, why we need that advocacy perspective, we will go ahead and highlight some advocacy voices. So today, once again, we have Paul Bosworth and Darcy Keith, who will go over our Survivor Speaker Series. And just so you know, this is once again the qualification, and we are happy to share this PowerPoint with anyone who wants. So Darcy and Paul, can you explain your experience with chronic conditions and living with chronic condition due to your brain injury, your experience through the healthcare system, and any coordination of care or lack thereof? And we'll start with Darcy.
Thank you, Denver. Actually, with traumatic brain injury, I am so excited that it's a chronic injury, because one thing, as those of us who've experienced brain injury know, that it is not static. It's not, hey, you've got a broken arm or broken leg, you heal and you're good. It's dynamic all the time. So things can develop as we age, and that's why it's very important. Now, for me, I have, from my traumatic brain injury, I have some right side weakness from my left lobe injury. I also have vertigo, so dizziness, and actually that is a symptom that came on like 4 years after the fact. So that would follow along with a symptom that may come at any time in our lives. Now I'm 33 years post-injury, so there are a lot of things that have come up within that 33 years, such as I have sleep disturbances also. I have migraines, those came on kind of after the fact also. So in my aphasia, I noticed that it is becoming more prevalent in everyday activities. So those are some of the chronic and lifelong symptoms that I have due to my brain injury. Now, as a person with brain injury, this recognition makes me feel three different things. It makes me feel validated that if the symptoms comes up during my life, it's not like, oh, well, you should be over that. This injury, you're good now. It's validated that yes, this can happen, that we can have injuries or illnesses come up from our traumatic brain injury throughout our lifespan. So that was one of the things that makes me feel really good about this. Another thing is I feel relieved. I feel relieved so that if there is a symptom that comes up later in life or down the road at any time, that I'm going to be taken care of if I'm under the Medicare CSNP as Denver described. So I'm relieved that those services will be provided for me. And the last thing that I am is I am hopeful. I am hopeful that other organizations will jump on board and acknowledge brain injury as a chronic condition, such as the CDC and any other regulatory organization. So that will allow us, again, services and treatments and better life expectancy, better quality of life. That's why I'm really, really excited about this, because we will have a better quality of life as a result of this. And on the flip side, service providers will have a better opportunity to give us the services that we need, because there will be a standard of care for us having the chronic condition. Now, coordination of support for me during my injury is I had private healthcare insurance, and my primary care coordinated with my neurologist, coordinated with my therapist. So I was fortunate to have that type of coordination. Now, what would I like to see in the future about traumatic brain injury being a chronic condition? I would like to see the importance, again, in the quality of life for us, because this is going to provide us the solutions that we need to have a better quality of life. And that could be through extended rehabilitation services. That could be also prevention and reduction of comorbidness, or having other things that come up, other medical conditions that come up into our lifestyle. So for example, with our traumatic brain injury, we may have like hypertension, or we may have high blood pressure, or we could have excuse me, heart disease, or something like that that comes up later as a result of our traumatic brain injury. Those are just a few things. And we know that now, if we have that chronic condition as a traumatic brain injury, that'll also help with our other chronic conditions. So that's what I wish to see for the future. I wish to see CDC and other organizations jump on board and adapt traumatic brain injury as a chronic condition as well.
Thank you so much, Darcy, and I appreciate you highlighting the need to push chronic condition as a huge part of this narrative. Paul, would you also like to provide your insights on your experience as living with a brain injury, coordinated services, and your experience with the system at large?
Sure, and thanks for having me. Darcy did a great job on spelling out what we're looking for, what this is about. And I have to echo a lot of what she said in the fact that when I had my brain injury 17 years ago on September 11, 2007, I was treated and released from a class 1 or a trauma 1 center. I forget what you call them. And I realized that my life was getting worse by the hour. And the more I complained, the more I got medicines to shut the complaint up, like stop the complaining. I never got to actually feeding my brain or giving my brain what it needed, which was probably nutrients, something to heal with. And that's where I still today end up helping others through support groups and other channels to help them realize, hold on a minute, some of this can be done ourselves. Not all of it has to be scary and weird. It can be broken down into, like, for instance, if your car is out of oil, oil can go into 3 or 4 different places. Check all of them. Don't just check one. I stood in a phase of telling people I've done everything, I've tried everything. And the onus was still there that I wasn't believed completely. Mm-hmm. I was at fault here. I was to blame here. I was to hold this bucket of brain injury and just deal with it myself, which through help of friends, I've lost some friends and family along the way because they don't understand this. They can't comprehend this. You're not supposed to have a brain injury that lasts more than 90 days, says my insurance company when my insurance stopped. I do overlap with Darcy in the fact that I had to pay $15,000 for an oxygen therapy that allows me to talk correctly. Without it, I'm stuttering and stammering and I'm losing my words and I can't find the next one and I don't know where I'm going. And what were we talking about again? That's very off-putting to somebody that used to run between $6 million and $30 million deals with a large computer manufacturer, top 3 in the world. And I can figure this out, not by myself, not by myself. So this announcement gives me validation. Like Darcy said, it gives me hope for the next person that walks up and says, hey, I have a traumatic brain injury. They're calling it post-concussive syndrome, and I need you to believe me. And this helps the person get over the threshold to say, yeah, I've heard of that before. Not the rote, which I'm used to, is brain injury. What does that mean? You mean like a car wreck? What does that mean? It's off-putting for sure, and it pulls us into an alone spot. And geez, nobody understands this. I'm the only person who understands this. That can't be. I didn't have coordination and support because I was under the assumption that I could do it myself. Boy, was that wrong. That took 5 years to figure out how I really did help my brain along on my own, and a lot of common sense with it too. Like I mentioned earlier, where is the water missing? Do you need water in the radiator? Do you need water in the windshield bug spray wipers? Where do you need water? Where do you need sleep? Where do you need all these things that help repair the brain versus sit there and tell me there's nothing. Yes, there's over 30 different modalities that I've found that have helped me in one way, shape, or form. And this announcement helps me and others behind me and the folks coming into the facility, like I mentioned a minute ago, have validation that yes, we've heard of this, and yes, we know what to do with this, or we have a clue about how to do anything with this. Oxygen therapy changed my life. Cannabis is managing my life very well right now. And a lot of other survivors are with me. I've checked. I've spoken to over thousands of survivors because I'm asking, this is my life. Where are we going? What are we doing? Is this validated? Now it is. Now we can move forward. And one last thing, the acquired and all the other technical aspects, sign up for this, figure out whether you're appropriate to be on this list. We need everybody, all hands, to come together and say, hey, I've got a brain injury, sign me up, I want to be part of the list. And oh, by the way, we throw a heck of a party the first week of March in Washington, D.C. for awareness only. And thank you for smiling, Darcy, because you'll be there too. We go every year. I've gone 15 years in a row. And last year, the oxygen therapy was rolled out in North Carolina for all the veterans there. So yay, veterans. Thank you very much for having me.
No, we appreciate your perspective. Thank you so much. And thank you for highlighting the need for coordination of care. I think that's a whole thing. And everyone who's in attendance knows that brain injury is not just in one part of the body, it affects all of it. So thank you for highlighting and using your experiences there and getting us early to call to actions, which we'll circle back to, but some great steps in which ways people can get involved. So I appreciate it there. So we have had some folks join in the middle of the call, so I just want to reintroduce and settle what we are doing today. So my name is Denver Supinger, Director of Advocacy and Government Relations for the Brain Injury Association of America. We have Paul Bosworth, one of our survivors and part of our Survivor Council, Darcy Keith, and then Karen Kimsey, former Director of DMAS at Virginia. And we're really excited to be talking about this advancement when it comes to CMS adding traumatic brain injury as part of its chronic special needs plans, which we will reference as CSNPs. If you do have a question, I see there are a few hands raised. If you could just put them in the Q&A or chat us, that would be wonderful. But there will also be ways to contact us and get involved at the end if you have lasting questions and want to circle back. And I know I want to apologize that the slides were not originally showing the information I presented. We will circle back to that at the end to make sure that people have a visual cue and follow up with that, as well as the auditory. But next, we're going to go on to about the Medicare system and advocacy. A lot of folks are like, great, this plan is included. What does that mean? How does that impact me? And basically, so what? right? How is this going to translate to direct care for me and my loved ones, which is the heart and reason why we are here. So as I noted, with this, you do have to be part of the Medicare Advantage plan, so it does not apply to the original plans, and that allows for better coordination of care when it comes to physicians and doctors within that plan that you see on a regular basis, and covers more services within your insurance provider. We recognize that this is limited to, as we noted before, to the folks that one are part of in the location in which the provider, the payer, offers a plan, so the special needs plan, and two, there's no mandate for provider or for payer, excuse me, to offer this special needs plan. So it might be an option and recognized by CMS as a possibility for payers to adopt, but does that mean they're going to take the initiative to do so? Which goes into our advocacy and the ripple effect. How do we, one, ensure that this change at CMS, which is limited to if the payers wants to do so, and if you're in that location for that plan, how do we expand that impact? How do we make sure that we are bringing this to the states? How do we make sure we are changing narratives at this at our federal level, expanding protections elsewhere, and really seeing how chronic condition be leveraged beyond the CMS designation to uplift our community and expand services. So with that, I'm going to pivot over to Karen to take us to the next level of what does CMS chronic condition designation mean for Medicare patients, and what does it look like?
Thank you, Denver. Hi, everyone. My name is Karen. It's really an honor to be here with you all today. I'm a stuffy bureaucrat or former stuffy bureaucrat, and some people may joke about it. I used to be with the Medicaid program for over 27 years, and I'm a social worker. So a lot of my background is developing programs that served individuals and communities and settings. And so imagine my surprise developing lived experience with this when I lost a dear brother of mine at 30 years of age to a significant traumatic brain injury following an aneurysm after he lingered in a nursing home for 4 months. And then also myself, 7 years ago, I still have post-concussive syndrome, a significant injury following an explosion, of which I didn't know if I would ever return to work. But I did through lots of hard intensive therapy. And as Paul and Darcy were talking, just a lot of strong determination on your end, trying to find other solutions that are beyond what insurance covers. So I learned a lot, very humbling experiences as somebody who's had some direction and control working in these programs. And so here to just help you with some of these pieces. So the designation is really important. When I saw it and the team contacted and said, this is what happened, I was so excited to see it. It does open doors, everyone. Even if you're frustrated with the system and don't feel that it has a lot of capacity for you right yet, this is the opportunity to help bring that forward. So what does that mean? It means, and Denver was talking too about this, that there are these special Medicare Advantage plans that are out there that allow companies like the Anthems, Uniteds, depending on where you are, and there are different companies, as they were talking about, spread all across the country, that they can create these programs that just tailor people with traumatic brain injuries. And that means they provide services that can be more unique to your needs, such as specialized cognitive rehabilitation, mental health services, because people don't always understand. Paul's right that it's like when somebody says you've had a concussion, they think, oh, in 90 days, you should be over it. They don't realize, and Darcy's talking to us too, this is a long-term, lifelong issue for us to manage and live with. So this also gives the tools for the plans to provide services that are more long-term in nature that help to support folks as well. There's also, with the C-SNPs, that means it's just a very specialized condition for only people with this chronic condition, which is amazing because remember, chronic condition in this country is also asthma, diabetes, heart failure, congestion. So we're now in the players with the big ones. And so that also counts as a chronic condition. So if, for example, there's a program in Medicare that helps with care management and coordination, but you have to have 2 chronic conditions. And so hopefully with this being added, that will also help enable people to be eligible for these types of programs as well, to better support them. There is also a Medicare product called a dual special needs plan. That means if you are eligible for Medicare and Medicaid, there are almost 13 million of us out there, systems in the system that can qualify for that. You're also called a dual eligible. So that's why you see it called a dual special needs plan. It's called a DSNP. You know, leave it to the government, have lots of acronyms. So we have CSNPs and DSNPs, but that's what it's called. And these are the types of programs. This program itself can actually help you coordinate your care for Medicaid and Medicaid in one plan, one person, one number to call, in terms of navigating these really hard service systems of care sometimes. And I do know that they differ sometimes from one state to the next, and we can talk about that a little bit as well, about your opportunities to help change that. Also in Medicare, there are services that you may be eligible for because of the chronic condition nature. They may consider extending, for example, telehealth and certain types of services you may need. It's usually done in mental health services, but they may expand it because COVID forced that all wide open to actually start exploring like how people can be better supported in their homes. And that's an example of that. Also other examples, we mentioned extended long-term rehabilitation, not just the short-term that you can get under nursing, right? Or home health benefit, where someone says, okay, we think you've reached your capacity, good luck with the rest of your recovery. This means it's more long-term that you don't have to keep getting permission to get authorized. You can keep going back as you need it, as long as you need it. So that's important too. And also mentioning home health, chronic health condition can also qualify you for getting more services and supports as you need them in either home or other settings. And so for Medicaid people, this is huge as well, because people always talk about, and you look at Medicaid, and this is the program that, so Medicare, just in case folks are not sure, is the federal program that is for individuals who are 65 or older and qualify for health insurance. And if you have a disability, you can qualify for Medicare. Medicaid is the program that's run by the states and the federal government, and it serves individuals, primarily low-income families, children, adults who may be working and struggling to find other means of insurance, and also most especially people with disabilities and seniors who need long-term services and supports. And so when Medicare designates a special condition like that, that means it's an opportunity to expand how care is provided, not only in Medicare, the bigger federal system, but Medicaid as well. And that's the great part. So some states do, for example, offer brain injury waivers, programs that are unique to help keep people and their communities thriving, but not all states do. And so this designation could help open the eyes to states who may not be offering that just yet, to say, hey, if CMS is saying, our federal partners are saying this is important, maybe we should take another look at it too. So that also gives you enhanced care coordination at that level as well. We just talked about that at the Medicare level. And also, not just on the Medicaid piece, let's see, just making sure I'm covering all of that. I also wanted to bring up the pieces. It also helps with state-funded programs that may be, or programs that are done at non-for-profits that are federally funded, such as maybe bringing services or other different types of nonprofits that maybe you're volunteering in or you're being supported in. Additional dollars may be able to flow to organizations that provide supports, especially if it's been designated as a chronic condition. Yeah. That was a pretty long-winded answer for that question, but.
I appreciate it. Thank you so much. Can we dive into the reality of change? I know I'm skipping to the third question, but can we skip to the reality of change on the ground, and what that looks like?
So some of the pieces, the reality of it is, and I know it can be very frustrating for folks trying to figure out, navigate these systems. And it feels like it's like these towers that sit in wherever your state capital is, and it's very hard to reach them and call them, and you just don't even know where to start. And a lot of these organizations, that's where the piece is that the most important part, in my experience working in these systems, is that you're the ones that drive. You're the ones that help make this difference and impact happen. And that's by making sure they're open and understand and are aware what your needs are and what your impacts are when you don't have these types of supports in the system and what it will mean for you and others if it does. But even if you have people who are willing to champion it, you have a governor or maybe a system administrator that's like, yes, we're going to take this up and we're going to advance this and develop this program. They still have what are called, the budget cycles that states run on with. They have to decide what the policy is, set that, and then generally they have to go to their state legislatures and ask for authority and funding. That's where you can come in handy to really help advance that and to move that and make sure that that process goes as smoothly as it can be. It can take some time, up to a couple of years or longer. And I know a lot of you may have even been involved in this and understand that it can take some time, but don't lose heart on that. That's the big piece here, is just really getting out and helping to educate people to understand why this is important. And then also know and learn at your state what your state processes are. When is it a good time to go and ask for a new program or services? Who do you know that is a big champion as a legislator in your state who can help you find the funding to get these programs up and launched? Because when you do both sides like that, when you're working with the state at the we call it the executive branch, the agencies, and you're working with the legislature at the same time, that's where it gets really powerful and you can make change. And that's where the reality is that it can happen, it can change, but it just requires a lot of diligence and perseverance. But I know this group is up for that.
Absolutely. And I am very proud to say we have a strong affiliate networks who are working at our state levels with their executive branches or state legislators to advance such protections and expand services within their state. So that's wonderful. I'm going to combine kind of 2 and 4 for us just to do high level conversation, but is there only one way to expand for services, right? What does that look like? How can someone empower their voice? And, what does the advocacy for further protections look like?
And I can answer this question and also invite my partners on the call if they have other thoughts as well, the panelists, to talk about that. I've seen, and I'm just going to talk from my experience and seeing really successful, like actually being able to go to a state or federal government and bring this up. And that's when people just start, and I mentioned it earlier, at the grassroots. They just don't go start to meet. They do email campaigns. Believe it or not, those are very successful. I've seen some policy changes at the state level even happen quickly within months versus a year or two, just by the sheer force of people writing in and saying, this is what matters to me. So just trying to think of, and media engagement. People take to social media, also trying to engage, state and federal partners and what they'd like to do. And just stating your case very simply and then making sure that they know and understand, and partnering with local media. Do you have a life story experience that you'd be comfortable with sharing and saying, this is what happens, it's because I had these supports that I'd wish to get for others, or it's not out there and we need this. That's also something people really pay a lot of attention to. When you're working at the federal level, going to Congress, like I said, writing letters, meeting with them, and meeting often enough, and letting them see and understand how you live and what your experience is. It is meaningful to them. They do take it seriously, but you have to meet with them often enough to keep it as a priority, because they're juggling a lot of those at the same time. And of course, staying closely connected with your national organizations such as BIAA, who are hosting this, to try and help get more people up and working and leverage their voice and helping to get the word out. And with the state, and as I mentioned earlier, and if you're really comfortable and you like to do this, just like we're up here talking, testify at state hearings, tell your story, tell your voice. I know it can feel scary. Even after I presented for many, many years, I was still shaky getting at the podium when I was telling my story to try and advance a brain injury waiver in Virginia. And so, but it's a lot of courageous work, but it's very worthwhile, and it does make an impact. And also make sure you utilize your state brain injury advisory councils. Take advantage of what's in your state and in your area, and work with them and leverage that. Also meet with the providers who can make this happen for you. If you are a member of a United Health plan, ask to meet with United. Talk to them, tell them what it means. Ask to meet with a care manager or a case manager. Just start and just work your way. And the providers are the ones that can also help make meaningful change. They can help lobby, they can help make changes. If they see that that's what it's important to you and to the systems, and that there's a lot of advocacy around that, that makes a big difference.
To Paul and Darcy, if you want to share experiences of how your story has changed things at the state and local level or changed perspectives.
Well, I'll start, Denver. In 2008, Indiana, we had sent a bill for the Brain and Spinal Cord Injury Research Fund. And what that would do would be to take like maybe $1 from every car registration and put that in a research fund that would support projects for brain and spinal cord injury. So I love what Karen said about meeting with your legislator and speaking your voice or giving your voice on behalf of that, because I was the brain injury survivor voice for that. And just the impact that my story had on the legislature was impactful for them. They could put in a face and say, this is how this research fund will help me in the rest of my life by providing maybe services or addressing needs that I have. So I think everything that Karen said is very on point to get involved with their legislature. Now, one thing that if you're like, I don't know what bills to look for, I don't know what's on the docket, I would just suggest looking at your particular state, and each state will have a list of proposed bills, and see what bill might be applicable for this, or see what like the Department of Health, if they've got something along the lines that they're submitting for proposal for a law. So just kind of check out your state's legislature or their docket to see if there's a proposed bill that might be applicable for you, and then contact the representative that is submitting the bill or sponsoring the bill, and just tell them your story and tell them you'd like to advocate by sharing it in the conference committee.
Can I go?
Yep. Sorry, it's you, Paul.
Everything what Darcy just mentioned is awesome, but I'm a little bit more grassroots. So I ended up going to my farmer's market and setting up a tent there and talking to people. And before you know it, we couldn't leave because they wanted more answers. They wanted more questions. What's the difference between this and that? What is this oxygen therapy that you talk about? The drugs that are out there to care for me all hurt me. They didn't help at all. It was a nightmare in and of itself. So I'm going to say oxygen therapy at least 10 more times because it gives me life. And I also can proudly say that I was part of an implementation about what I mentioned earlier in North Carolina, because I went to the United States Capitol area and asked for it. You're not going to get it if you don't ask for it. So ask for what you need. Even if it's not going to fit in that cookie cutter box, it's going to fit into another box. So keep advocating for yourself, keep asking for yourself, keep asking for the next person. And by the way, somebody mentioned dynamic. That's what brain injury is. I'm not going to have the same symptoms I had today as I will have Saturday or next Monday. So dance with it a little bit. I'm real easy with this because I have to be. I coach people that are walking out of the emergency room and care buildings, and they have no clue what to do next. Start simple. Advocate amongst your family. Start there. See how your story resonates with people, and pay attention to that and give homage to that. You've done a heck of a job to get to this spot. Keep going.
I love that. Thank you, Paul. Thank you for sharing that experience. And I know, especially when you're in the heat of recovery and trying to find next steps, advocacy sounds like a great hurdle, but people don't know unless they know. And unfortunately, that expands to every corner of society, especially when it comes to providers and understanding brain injury and what you're experiencing and your need for coordination and that continuum there. And that's why BIAA is really pushing for brain injury as a chronic condition to ensure that it's not a broken bone syndrome. It's not seen as a broken bone syndrome, but it's an entire life continuum. It's a dynamic disease or condition rather that follows a person, and we need to uplift that. But Paul also noted that grassroots is powerful, right? Start those conversations with your neighbors. Before you know it, you are going to have a community of support and community of advocates grow amongst you. And most people have experienced or know someone who has experienced a traumatic brain injury who may have different ailments associated with that experience. You know, people put a big sticker on lobbyists and what they do. At the end of the day, they're just people who make relationships and have conversations. At the end of the day, that's what you can do. That's what we hope that you will do, is to start building those relationships, because people don't know unless they know. And we are the power source and hub of knowledge for that. All right. Karen, would you like to follow up with anything else?
I think, you know, and I just thought everybody here just really echoed that very closely. Just know, and I know it can feel overwhelming at times. How do I make my part in this? And it can be something as very simple as helping to do some work in your community and talking, explaining and understanding, like, this is new, this is what it means for us, this is what is important to us, just to get the conversation started. I think for this, just a simple education and awareness, like for helping people just learn about it. Because this designation, while it's been posted, I can assure you it's not well known that it's been out there. And so I even talked to some state officials at 2 other states and they didn't even know. And so that's the big piece to get started with, is just to help make people aware that this designation has happened.
There was another advocacy thing that we did here in town. I just wanted to add it real quick. It's called a Better Brain Expo. So we gathered everybody from the doctors down. So the speech therapist, occupational therapist, physical therapist, counselors, and everybody else that's ancillary to the common core of the services. And we got them into one space, and they had a ball just meeting each other because they've heard about each other, but they've never actually met each other. And we did this 4 years in a row, and I can't count how many moms backed up against the wall and said, who are all these people? They can help me? My son needs help. This is where we are. Advocacy is so important, and speaking out is even more important. Thank you for allowing me to add that.
Beautiful, Paul. I appreciate you hosting that and providing that space. So thank you. And when it comes to education, I think that's a huge part. As we noted, that this is a Medicare Part D special needs plan, right? It's a very narrow scope of what this is, and it's up to the payer, so the insurance company, Anthem, United, what have you, to adopt these plans. So it's also upon us to go to our insurance providers, as Karen noted, and say, I have this condition, I have a traumatic brain injury, which is resulting in a chronic life condition, and I need you to ensure that I have coordination of care and that I am covered. So that education is huge, because I'm sure there's plenty of providers who are payers, excuse me, who receive this list of CSNPs, who are making decisions based on arbitrary dollars and cents numbers and not on real life, not on understanding how these plans and this coordination care will impact you directly. So being able to share that story, and we at VIA will be doing that as well, to ensure that we are pushing for adoptions of more chronic need, chronic condition coordination of care through all systems. So yeah, education and outreach, your voice is huge and it's needed in this space. And I know we have a lot of questions, so I want to give the last 15 minutes to that. So first, I know there's some folks who were questioning about the timeline, the process, the implementation. So as we noted, once again, a lot of questions are like, what is this plan? It's a Medicare specific special needs plan that is an option to payers, your insurance companies, for them to adopt and then implement within their pay system or within their insurance plans itself. The insurance plan can be limited to geography and limited to those who have access to that. So this is where that self-advocacy notion comes from, right? Ensuring that you are talking to your primary care physician to, one, let them know that this is happening, and two, working through Medicare and looking at plans and options for you through that system. With this, you may need a letter from your primary care physician saying that you do have a chronic condition linked to your traumatic brain injury. Once again, it's only traumatic brain injury that we're talking about, and that you need this special needs plan. So not everyone will be eligible, but that's where the conversation that Karen had of how we can advocate beyond this and how this is a huge narrative step forward, and federal standard that we're setting, with recognizing the continuum of brain injury. Practically, how do you qualify? You need to qualify for Medicare Part A and B. If you do that, then you are eligible for the C-SNP plan. If you are not of age yet, but you will become of age October of next year, you can look and enroll in a plan that, if there is one, that has this special needs plan when you enroll. Outside of that, the enrollment period is October 15th to December 7th for 2025 plans. So you will need to consult Medicare, your Medicare and You handbook, call them, or find the plan online to see if you are eligible for a plan, if that plan covers you. So we cannot give you, hey, you live in Texas and this and this and this. We can't answer that for you, unfortunately, just with the variety of plans that are being offered. But please consult your handbook and call Medicare directly to see if you're eligible. If you're in a current plan and there is a plan that has a C-SNP, you will have to change to that plan if your current plan does not adopt the new chronic needs special plan. So that is something to consider as this change goes forward.
Jennifer, may I add one more thing?
Absolutely.
Thank you. If folks aren't sure, Medicare is, the managed care companies can be very confusing. There's a website, Medicare Compare, you could go on, but there are people who are in your state. They're called State Health Insurance Program, or SHIP counselors. They, it's federally funded, and they're volunteers and part-time workers, sometimes at area agencies on aging or other local communities. And they will sit down with you at no cost for free and help you think through these things. That's all they do. And they're especially busy during the enrollment period. So if you're not quite sure what a D-SNP is, C-SNP, like where does that all fit for you, you can always go to a state health insurance program counselor in your state and ask them for advice, guidance.
And as someone who's been advocating through CMS, Medicare, and Medicaid, it is a very complex system. So we do have a hotline, NBIC, at 1-800-444-6443, who can provide some insights on next steps, and connect you with your local affiliate as well. And kind of fill in the gaps if you still have questions and confusion about coverage, support, and what have you. All right, we are going to go into questions, and there are plenty. So if we don't hit your question, I apologize, but we're going to hit as many as we can. So first, just to reiterate, this is for traumatic brain injury. We are at BIAA advocating for the expansion of acquired brain injury, but that won't take place if it is considered until 2029. So we're looking far out for that. But currently it is only traumatic brain injuries. There are some acquired brain injuries that are already covered, that have been covered, like stroke. So once again, connect with your Medicare system and look at your current insurance provider, and see if you can be eligible if you do have a stroke through that C-SNP plan as well. Once again, the C-SNP plan allows for better coordination of care and better coverage. Let's see, Carrie. This is only for Medicare Advantage plans. My understanding, and Karen, please correct me if I'm wrong, is if you have traditional Medicare, that would not be, the C-SNP is not part of that. But we will be advocating to have better coordination of services through that, but this specific CSNP is only for Advantage plans. Wonderful. We had a question, does this new classification allow us to gain better access to specialists and providers? So that once again will be determined by your insurance provider of what specialists are covered. Theoretically, yes, it does allow for better, more specialists to be covered. But once again, those specifications are not made by CMS. They are adopted by the individual provider. Let's see. Carrie, would you mind asking some of the questions aloud as well? Oh, I know folks are asking why not Medicare, regular original Medicare. The adoption of CMS with the chronic condition and recognizing TBI as a chronic condition is huge in setting that standard. So this will be a ripple effect to that.
I know we had a few questions about Social Security. If you're on Social Security, is there any impact on the coverage that you would get through Medicare? So is there any overlap there?
And Karen, are you more fluent in the Social Security? I know that comes down to state Medicaid plans.
With Social Security payments, I don't think that there's any impact that will be had on this designation. And the only piece is that, for example, like if you have both Medicare and Medicaid, they may have a special needs plan. It's a CSNP, DSNP, like you may be eligible for enhanced care and support as having both. But I think in terms of having a Medicare payment, your Social Security and others, I don't think that there's an impact on that, on the amount that you receive.
I know there was confusion with the mention of years, so let me clarify. The TBI designation will be effective for 2025 plans. So you will either have to, if it's available within your area and you see a plan that covers this chronic special need plan, you'll have to enroll into that plan for 2025 onward. Or if you become eligible for Medicare, let's say October of next year, when you enroll is when you can then adopt that plan. But 25 onward is when the plans are effective. The 2029 date is the next time that new CSNPs could be added and where we're advocating. So unfortunately, we will not see immediate turnaround with acquired brain injury, but we will be fighting diligently for when that new update is there to make sure all acquired brain injury is included in 2029. But currently it is TBI and some acquired brain injury under their own designation, which includes stroke. There's a really great and practical question in the chat, which I love, is what is CMS? CMS is the center, and thank you so much. I think we get so tied up in our lingo. It's very nice and needed to have that reminder. CMS is the Center for Medicare and Medicaid Services. So it's the federal agency that oversees and handles Medicare and Medicaid services. So stroke is currently already covered by the special needs plan. So when you should be covered, you might need to go to your physician and have them do a letter stating that you do have a stroke and will need coordination of care and bring that to your insurance provider. But once again, you will have to look at your individual insurance provider to see if they cover or carry that special needs plan. The re-enrollment period is coming up October 15th to December 7th. So if you do find a new plan in your location that covers either stroke or TBI, you will need a change. And we keep saying CSNP, we identified this early on, but CSNP is Chronic Special Needs Plan. So it's a special plan within Medicare Advantage Part D that covers chronic conditions. And allows for better coordination of care. And I love this question. So we might have some advocates on, and Karen, I'm going to push this over to you, if that's okay. We have some advocates on who want to know what the difference is between acquired brain injury and traumatic brain injury.
On the acquired and traumatic. So as I understand it, the traumatic is what happens to you on the outside, and the acquired is it happens as a result of an illness or on the inside. Like I call it on the inside for me. And so when most people, and you talk about legislators and different folks, they think of the traumatic brain injury. Although, as I mentioned above, stroke is kind of an acquired injury. So it's interesting that they're bringing it up. So some of it's just, and just for you to know that happens a lot, unfortunately, that there's confusion about that. So it's just important to say these are the differences, but the impact is still the same. And the injury is still the same. How it happens should not always matter in these discussions, but they do when, and I'll be honest, when they're first trying to, and I've seen this with brain injury, is they may start with traumatic brain injury to kind of get experience with it, and then add acquired, because sometimes, I hate to say this, but there's a perceived notion that may be a lot of cost for creating a new program. So they feel like, well, we'll just start with a TBI group and then grow. I'm not sure what CMS's decision was one way or another on that. I've just seen it for, so it's really a matter of just education and understanding and helping them to know. And it's not always entirely intentional. People may have added it and not even realize that acquired brain injury wasn't a part of that until after the fact. That happens too.
So, great way of saying is traumatic brain injury is because of an external force. So hitting your head, car accident, sports incidents, what have you. ABI can happen because of anoxia, hypoxia, strangulation, stroke, carbon dioxide poisoning, lack of oxygen, or something else happening inside the brain. So just to higher answer that. There were questions, and I'm sorry if there's any confusion of, does this mean I have to enroll in a private plan because I'm on Medicare? No, Medicare Part D is a partnership with private insurance companies. So that's the Part D spot, right? If you're already eligible for Medicare, you find doctors that accept Medicare. Medicare Part D is an extension. So you're not enrolling with a private insurance, you're enrolling, it's part of the Medicare Part D plan. So, and that's a partnership between Medicare and a private insurance company. And then that's why the private insurance company has the liberty to decide if they offer a special needs plan, where that plan is offered and what services are covered underneath it. So I know there's, once again, Medicare, Medicaid is extremely confusing, especially when you go Part A, B, D, C, everything that's in within. We're here to help, and also the Medicare hotline is there to help and can open some doors and answer some questions there for you. With Medicare, the age range is 65 plus. Yeah. All right, Carrie, do we have any other questions? I'm just scrolling, but I know you have a better pulse on things.
I think that covers mostly what we got. If we did not answer your question, or you have more questions that pop up later on, please reach out to us. We'd be happy to answer them. You can email us at communications@biausa.org. And Denver mentioned our hotline number, the National Brain Injury Information Center. It's a free hotline that will connect you to a brain injury specialist. And if you missed that number, it is 1-800-444-6443. So if you reach out to any of those, through any of those methods, we'd be happy to answer your question.
So next steps, we would love for you all to get involved. Hopefully you got a lot of information from this, and hopefully it wasn't monotonous, but I think I believe we paved a pathway to show that this is just step one of many. And we need you, your voice and experience to push at the state level, push for further protections at the federal level, and more. So some quick things you can do is sign up for our advocacy updates with the link on your screen, or you can scan the QR code. We also highly encourage that you get acquainted with your BIAA affiliate. We are proud to say that we recently merged with or joined with US BIAA under 110. So our network is even further than it has ever been. So no matter where you are, we will find a way to ensure you are engaged and can have your impact at the state level and help us with our state plans. And then finally, what Paul already teed up is we have a national conference every year where we go to the Hill, we speak about our issues and speak about legislation impacting our community. This is a premier first look release on our dates for 2025. We will be in DC March 3rd to the 5th of 2025, and we hope you're able to join us for this really impactful space for our community to come together and then raise our voices together. And that's just a little preview from last year. And if you still have questions, we have it there. But yeah, thank you so much for joining. Thank you to Paul and Darcy for leveraging your voice and providing some perspective. And Karen, thank you so much for being a champion and providing agency perspective there too.
My pleasure. Thanks for having me, Denver.
Of course.
Thank you so much. This is so important.
Yes, and thank you for all our 100, well, many, well over 100 attendees for coming. We really appreciate you all.
Thanks everyone for coming today.
Thank you.
Thank you.